For more on healthcare now, I'm joined by Dr. Nancy Nielsen. She is the immediate past president of the American Medical Association, and she joins us from Buffalo. Dr. Nielsen, welcome to Bloomberg News.
Good afternoon, Mark.
Dr. Nielsen, you heard what our Kristen Jensen was saying. Apparently, there's going to be a fight over this in Washington. Give us a sense, if you will, from your perspective, what in the bill is the AMA backing, and what in the bill does the AMA have some concerns about?
Well, we haven't seen the final Senate bill yet. That's the problem. We do know that there were some concerns about earlier bills in that they did not handle a few things that we felt were necessary.
Such as?
Well, we know for sure that they weren't going to handle the physician payment problem that has plagued Congress and the country for the last 10 years.
Is that a deal breaker, Dr. Nielsen?
It is a huge problem. It is a foundational issue for us. But there are people suffering in the country. So clearly what we need is insurance market reforms. We need insurance coverage for all. So there are many things other than this. But for doctors, seniors, military families, this is really critical to make sure that they have access to people who can care for them.
Dr. Nielsen, what about the public option? That really does seem to be a deal breaker. There are Republicans who are saying that they will not vote for this legislation if it contains a public option, as do some conservative Democrats. Is the public option something that's necessary for real health care reform to pass in this country?
Well, the AMA has already written to Congress several months ago saying we didn't think that a public option was necessary. But our House of Delegates has elected to remain neutral until we see what the public option alternative is really all about. So we'll make a decision on whether to support that or not when we see what the parameters are of that public option. But no, we think it probably isn't necessary, frankly.
And why not, ma'am?
Well, because we think with insurance market reforms that would go a long way to make sure that people have access to affordable health insurance. You could have insurance exchanges, as has been talked about in the Senate. So we will see. And obviously, this is a very a lightning rod with those in Washington and with people across the country.
Right.
And when you say public option, it gets kind of a visceral response.
Yes, it does.
We need to know what the parameters are of what they're talking about, and then we will respond appropriately.
Dr. Nielsen, does the size of this and the pay scale of this give you cause for concern?
Well, let me tell you what gives us more concern, and that is 46 million Americans without insurance, and medical costs being the #1 cause of personal bankruptcy in this country. We're at a crossroads. We really do need reform, and the Doctors of America have said, let us try to help you shape it. So we are appealing to the members of Congress to say, please have courage. Let's do what's right for the country.
Is the restrictive language concerning abortion also going to be a roadblock to this?
I don't know about that. It is a very serious concern. We stay out of that issue in the AMA because there are people of goodwill on both sides, and it's a very, very divisive issue. So we stay out of that one.
Dr. Nielsen, in about 20 seconds, is this going to get done this year?
We sincerely hope so. The country really needs it, Mark. It's time. We are going to be a point in history. We're either going to turn away from this reform or we're going to do something meaningful for our people.
Dr. Nancy Nielsen, the immediate past president of the American Medical Association, joining us from Buffalo. Dr. Nielsen, thank you so much. We appreciate it.